Do you feel unsure when discussing results? It's a challenge many GP trainees face. But imagine starting every consultation with clear structure that makes the conversation flow naturally and boosts your confidence. Let me show you how. Hi, my name is Dr. Erwin Kwun. I help GP trainees pass SCA with confidence. By the end of this video, you'll have a clear strategy for discussing Paget's disease. We'll break it down step by step so you can confidently explain the condition, discuss treatment, and address patients' concern in a person-centered way. This tutorial will give you the tools to handle any discussion of results with ease. Let's get started. So we've got Jane Smith, 63-year-old woman who was seen by a GP 2 weeks ago. She presented with a 3-month history of dull worsening pain involving the hip, and it's been affecting her daily activities. So as we can see in the case vignette, there's quite a lot of information. So when you have your 3-minute reading time, it's important that you prime your case. So make sure that you're reading the case vignette carefully. I've even heard a GP trainee telling me that he forgot to turn the page and only read a few pages and missed one of them. So make sure you read the page from the start to the end. So what we can see from the blood test results is that the full blood count is normal, UNE is normal. When we look at the liver function test, there is an isolated elevated alkaline phosphatase, but the rest of the enzymes are unremarkable. Calcium level appears to be normal. The vitamin D appears to be normal, and the PTH is also normal, with the inflammatory markers unremarkable. Based on the information provided, it is suggestive of Paget's disease of the bone. So structuring your consultation is vital. This is a consultation that I will approach as a breaking bad news. The patient might not be expecting Paget's disease when we discuss this. So it's useful to break the consultation into 3 parts. The first part, from start to 3 minutes, is about giving the patient the results, so giving the news. When you start the consultation, it's helpful to understand the patient's perspective, so get the perception of what's been going on and what's the understanding of the test. By gathering that data, then you will be able to interpret the results in context. A common pitfall that GP trainees make here is they go back to the history and ask all these questions that you would ask in a first presentation. Remember, this is a follow-up consultation, so a history has already been taken. You don't have to go back and ask a history from scratch. What you need to do is use information provided and explain to the patient that you've got the results and set the agenda to discuss the results. It's important that you discuss the results at around 3 minutes if possible. If you leave it too late, then it's going to be difficult for you to get more information, because the thing is, once you deliver the results, the patient will have emerging concern and they will react to the results, and they might become a different person. So you need to have enough time for the second part of the consultation, which is from 4 minutes to 7 minutes. This is where you're dealing with the patient's emotion and impact. So you need to show empathy and make sure that you elicit the patient's ideas, concern, expectation. Let's come back to the giving the news now. When you deliver the results remotely, it's important that you check whether it's a good time for the patient to have this discussion with you. Make sure you give a warning shot before delivering the bad news. So you might say, this is not the results we're hoping for, and the patient will understand that there's bad news coming. And then you can explain to the patient that the blood test has revealed that you have a rare condition that affects the bone called Paget's disease. Then you can interpret it based on the patient's symptom, as in, this would be why you're having this pain in your hip. So now that you've delivered the results, then the patient might have new concern about this diagnosis. Should I be worried about this, doctor? And then you should be able to respond to their concern and reassure them appropriately. So this is in the middle part of the consultation. And then in the last part of the consultation, from 8 minutes to 12 minutes, this is where it's more about what you're going to do about it, involving the patient in the decision making, as in, if you're planning to arrange further investigation, maybe you want to arrange a bone scan, you might be thinking about referral, discussion of treatment, referral to the rheumatologist, and discussion of IV biphosphonate. So when you're explaining this to the patient, don't use the word IV through your vein. That's more layperson term. So let's dive deeper into Paget's disease of the bone. It's a chronic disorder where there's increased bone remodeling and there's overgrowth of bone and poorly organized bone that makes it weaker and leads to complications such as fracture, and some patients may have problems with hearing as well. So how would you explain Paget's disease of bone to a patient? So you might say to a patient, Paget's disease affects the way your bone grow and heal, which can make some areas like your hip weaker than normal, and you might experience pain. So you see, this explanation is adapted to the patient's need and relatable to their experience. Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. It might be helpful to use analogies when you explain a condition. So for example, you could say to the patient, our bones are dynamic. It's a bit like a house. You know, there's always something to repair and something breaking. So the bone structure keeps growing and repairing itself. In Paget's disease, there is a problem where the way that the bone grow and repair is affected. And this is where you might have the bone breaking down, and when it's repairing, it's not repairing well, and that's where you have weaknesses. Investigations for Paget's disease include blood tests. So this is where you can have an isolated elevated serum alkaline phosphatase. Imaging tend to show mixed lytic and sclerotic lesions. So if this patient has an X-ray, you might possibly see some lytic lesions. The first line treatment is biphosphonate. Zoledronic acid intravenous is what you would typically go for, and this is a treatment that is administered in secondary care. So this patient would need a referral to rheumatologist or a department where they would do that. For pain control, paracetamol and non-steroidal anti-inflammatory drugs if there's no contraindication. There are other parts of treatment that could be discussed. For example, physiotherapy if the patient has been experiencing issues with the mobility. In some cases, surgery might be a consideration. However, surgery is rarely done for Paget's disease. But if there is fracture involved or severe deformities that need to be corrected, you might consider monitoring the ALP level, assess a patient's symptom over time. So if you're discussing zoledronic acid as a treatment, it's important that you're aware about the side effect. So patients can have problem with their jaw, especially if they had any dental workup recently. You might also want to inform the patient of the side effects, so they could develop flu-like symptoms when they take zoledronic acid. If you found this video useful, you might be interested to watch the consultation framework, in which I show you exactly how to take a focus history. Click here to watch it. I'll see you on the other side.